The next 5 years will be delivered by a robot doing the treatment for our patients.
Cumulative of more than 1.5 million adult patients per year. Your groundbreaking research on digital technology.
Most of the orthodontists would relate for children being teased in school because of protruding buck teeth. Her daughter said, "Mom, have you gone mad? You'll align your teeth at this age." Many of us are totally unaware. Regenerative medicine, AI and machine learning. We recently have created an AI algorithm. It's a library diagnostics.
About personalized medicine, global, sustainable and digital. What future trends do you foresee?
You can't have one solution to all the problems.
Hi and welcome to the Manav Rachna podcast, where we bring you the expert POV of the leading academicians and industry titans across sectors. This is 𝐓𝐈𝐌𝐄𝐒𝐓𝐀, your host for the episode. Today we have with us a luminary in the field of dentistry, a globally renowned orthodontist, Dr. Puneet Batra. Welcome, sir.
Thank you, 𝐓𝐈𝐌𝐄𝐒.
Dr. Puneet Batra is the principal of Manav Rachna Dental College and the president of Indian Orthodontic Society, being the first alumnus of the All India Institute of Medical Sciences to hold this prestigious position. He has been recently honored with the distinguished Lee W. Graber Orthodontics Changing Lives Award and the Black Buck Stellar Research Award. He also serves as the chair of Cleft and Craniofacial Anomalies Board and a member of Smile Train India Medical Advisory Council and the Smile Train Research and Innovation Council. It's truly an honor to have you with us today, Dr. Batra.
Thank you so much, 𝐓𝐈𝐿. I look forward to this podcast.
So first things first, let's start with addressing the elephant in the room. So the connection between oral health and systemic wellness is not widely known or discussed, but it is crucial. Could you tell us about the implications that dental health has on systemic diseases, say cardiovascular health or maybe diabetes?
Like you said, it's the elephant in the room. The problem is that many of us are totally unaware. The oral health is an indicator and is also one of the most important, reason why we could improve our systemic health. Now let's talk about, cardiovascular health. What happens is that around the teeth, the gums get inflamed because of improper oral hygiene, because of multiple oral habits, and what happens, these bacteria may transfer from the bloodstream into the cardiovascular system, causing inflammation of the arteries. So it can lead to atherosclerosis, and there is research to show that about 20% of the patients who are periodontitis patients who have inflammation in the gums are likely to have cardiovascular disease. So it's a big number. And also we need to understand that what happens is that the bacterial load may transfer from the bloodstream into the cardiovascular region and may lead to strokes. So, it's a big cause, and the cause and effect relationship has been established. So, it's very important to maintain good oral hygiene. Now, let's look at diabetes. Diabetes is a chronic disease which is affecting millions of people globally. Diabetes and oral health are interrelated bidirectionally. Why? Because bacteria are, when they have food, they are going to survive. And in diabetes, the blood sugar levels are high. So, it's a mutually relationship between both, that a person who has periodontal disease is having, or gum disease is likely to have more bacteria. Patient with more caries tendency is likely to have more bacteria in the oral cavity. And diabetic patients whose immunity is down, whose blood sugar levels are high, are more prone to infections. So, having an oral cavity in a diabetic patient is a problem, because gum loss, bone loss is going to happen, and this bone loss is going to create more pockets where more bacteria are going to lodge. So, it's kind of a vicious cycle. So, coupled with this are other factors: our lifestyle, our maintenance of oral hygiene, obesity, that's a common modern day problem, and also smoking. So these coupled factors become a deadly combination of diabetes and cardiovascular disease. So systemic health is related to oral health, but what do you do to prevent it? Maintaining of good oral hygiene, proper brushing, flossing, as well as visiting the dentist frequently to get oral prophylaxis or scaling and polishing done so that the bacterial load in the oral cavity is reduced to the minimum.
That's such a valid point, sir. I think more awareness is required around it for people to understand the importance of oral health. Just curious, does epigenetics play a role in dentistry? If yes, how does it impact dental development and treatment planning?
Again, Akanksha, very pertinent question, because we all think that our genetic code or our DNA determines how our life is going to be, what illness is going to happen, but the environment has also a critical role to play in the expression. For example, if you had two twins, one of the twin was brought up in a very cold region and another was brought up in a hot region, their body response and their development would be different because of the environment. So we need to understand that the environment has got a major role in our expression of tooth development. For example, tooth anomalies like small sized teeth, like enamel disorders may happen because of the environment, the fluoride in the water and multiple other reasons. So you might have enamel developmental defects because tetracyclines or some drugs were given during pregnancy. So it's an environment which also determines the tooth formation, morphology, and tooth formation is happening in the mother's womb as the child is developing. So it is a critical factor. Now let us look at the development of major dental diseases like periodontal disease, which is gum disease, and caries. Both of them are also influenced by the local environment. The local environment may have a particular microbiology, a particular group of bacteria which are more present, and these might alter the environment, which is genetically determined, but now the environment is modifying the response of the body, so these ailments may become more common. Again, cancer. There are some cancer happens because of proliferation of cells which are uncontrolled. Now this can because of a particular environment in which we are, like some cancers are in regions where there is more exposure to sunlight or more exposure to lead, so these environmental factors modify the expression of disease. Now how environment or epigenetics is going to influence our treatment. So, personalized treatment, because everybody's body's genetics is different. So, modifying the epigenetics can make a person less susceptible. For example, you have a dental ailment which is because of a particular microbiota, and you modify that environment, you are likely to have preventive treatment protocols in place. Similarly, we are looking at regenerative medicine. So, stem cells and other aspects of regenerative medicine can be employed using the concept of modifying the epigenetics. So, epigenetics has a big role in expression of disease and also can be used in treatment of the disease.
Sir, as you spoke about personalized medicine, it has become a hot topic across all medical fields, right? Does tailored intervention apply to dentistry as well, and if it does, what all diseases does it cover?
Actually, you can't have one solution to all the problems, and now the era of personalized medicine is on the anvil. The reason is that all of us have a genetic makeup. There is a particular epigenetics and there are some habits which influence the disease, and they are also responsible for planning treatment. So now we are all looking at personalized medicine in dentistry as well. Let us look at the microbiome. The microbiome, what is there in an individual's oral cavity, is totally different from what would be in another person's oral cavity. Similarly, the genetics, the genetic predisposition to cancer, oral cancer, the genetic predisposition to various ailments is there individually. The third thing is salivary diagnostics. Our saliva has lot of immunoglobulins which help in prevention and protection of our body, so against attack by various bacteria. So the salivary genomics are also going to be different, and diagnostic factors are going to be different in every individual. So now let's look at a small intervention. We want to do a filling, so the filling for every individual is going to be different because of the caries progression. So now we have digital tools. We have digital planning, we have digital imaging, and individualized treatment option is created for every patient. Similarly, the role of personalized medicine also comes up in terms of prevention. For example, my microbiota is X, so I would do particular preventive techniques for prevention and removal of that microbiota or modifying my eating habits and other things. Also pharmacogenetics, one medicine cannot work for all. For example, if I have taken a paracetamol, my body reaction to that drug is going to be different from another person. So now it is an era where there is the role of technology and individualized and personalized care in dentistry as well.
So you spoke about digitization. Your groundbreaking research on digital technology for nasoalveolar molding in cleft infants, I would say, has definitely set a precedent, right? And it was also recognized with the Stellar Research Award. My question to you is, how are these digital tools transforming the approach in dentistry? And how is it enhancing the patient care, specifically when we talk about orthodontic treatments?
Actually, digitization has changed the way how we used to do dentistry. Totally. Imagine a patient going on to the dental chair, very afraid of us taking a dental impression, and then we are trying appliances in the mouth, they are fitting well, not fitting well. So things have changed. You don't need an impression, you are doing a scanning. So what you are doing is you are scanning the teeth, you are scanning the bone, you are scanning the soft tissue, and you are creating a virtual model. On the virtual model, on a computer screen, you can plan treatment. So computer assisted design is helping us in designing a restoration, designing a prosthesis, designing a template for implant, designing a splint. So all the procedures in dentistry are now on a computer screen. So the chance of planning for vectors changes, chance for planning the outcome are right in front of our eyes. They are visible, and we can communicate very well with the patient. He can see an outcome and then choose which outcome is more suitable to him. Now, computer assisted design is very good. Similarly, CAM is used to print a appliance. We are printing aligners, we are printing 3D printed devices, expansion screws, depending on the need of individual patients. So again, back to the earlier question of personalized care. So we are able to do that with digital technology. Now, another advantage of digital technology is the role of AI and machine learning. So we are having algorithms which help us in diagnosis. For example, we recently have created an AI algorithm which looks at the cervical vertebrae. As orthodontists, we take a cephalogram as an X-ray and we assess how much is the growth remaining. So the cervical vertebrae we made this algorithm wherein you put the X-ray, it tells you how much growth is remaining in this child who's growing. So it helps in planning treatment. So AI and machine learning is helping us in many ways in diagnosis, as well as also telling us what could be a favorable outcome in that case, the prognosis. Now, as you've done a scanning, you've done a planning, you've made an appliance. Now you also want to look at remote monitoring. Imagine a patient is just coming for a follow-up appointment. He comes from far. So he comes to you, he sits on the dental chair, we spend 2 minutes and we say everything's good, you can go back and continue expanding the screw, or your wire is doing well. In this era, post-COVID, we are connected well. So remote monitoring is something which is becoming a very big thing now, and all the appointments, the initial consult, the patient's concerns, the follow-up visits can be done remotely. So there are platforms available where we can plan to have an appointment with the patient and discuss about follow-up. So that reduces the patient's travel time. Everybody is busy in today's life. It reduces many other aspects of the patient leaving work, and also it enhances more efficiency. Another aspect is reduction in treatment time, because reduction in treatment time happens because your planning is so good. If you are planning a lab prosthesis, it is already done digitally and is more precise, fits well, so you do not need to come multiple times for doing a trial to ensure there is a retrial and before final delivery of the appliance. So digital technology has changed the way of everything. Also, you have imaging. You have imaging in this sense that you have virtual reality and augmented reality. So as a clinician, we can do things on a digital framework and plan surgery. I want to do a surgery of a particular lesion, and I have very good digital records. I have a cone beam CT record, I have everything digitally in front of my eyes. I can use various softwares and plan the surgery beforehand. So I have done it before, and now when I do it on the patient, it's so well planned and well executed. So digital technology, I think, is the future, and it has changed the way dentistry is being done. And in the next 5 years, we will maybe be only operating on the computer, and will be delivered by a robot doing the treatment for our patients.
Definitely. Digitization has definitely saved time, it is cost effective, and it is precise. What more do we need, right? So I came across this survey by American Associations of Orthodontics that said 1 out of 4 individuals who seek orthodontic treatment are above the age of 21, making it a cumulative of more than 1.5 million adult patients per year, right? As more and more adults now seek orthodontic intervention, are there any unique challenges that it brings to the table? And how are the current treatment modalities adapting to address the needs of the aging population?
Again, a brilliant question, because this survey by the American Association of Orthodontists talks about a very different story. A few years back, we had children only going to an orthodontist, and alignment of teeth happened then. And many of our patients used to come and ask, can my teeth be aligned? So I remember treating a 55-year-old lady who, she called her daughter in Australia, and her daughter said, Mom, have you gone mad? You will align your teeth at this age. So there is no limit to the bone remodels at any age. Now there are some unique challenges in adult patients. The first challenge is that because they are adults, there is a possibility of bone loss, and there is a possibility that there are restorations. There are some caries which have been restored, so they are different from normal patients. The bone density might be much less. So when you remodel bone, the time taken for remodeling is slightly more compared to a younger adult who's growing. So as orthodontists, we have to apply milder forces. We have to treat them slightly differently. The biomechanics remain the same, but we have to take care of the bone density, the level of bone which is there, as well as the restorations or any other work which is required. Now another issue with adults is that they may require interdisciplinary care, because there might be some missing teeth which have been lost over a period of time. So we want to create space where an implant can be placed or an abutment can be uprighted. So there are unique challenges when you treat an adult. The adult patients also have aesthetic concerns. Many of them are working people. They go to office or they interact with the public. So putting braces may be a question mark in some of their minds. They also want to get treatment done fast. Most of the orthodontists would relate that they would get a call one day that our daughter is getting married, or there's a function at home and I want my teeth aligned quickly. So there is no magic wand, it takes time, but now there are options of accelerating the orthodontic tooth movement. So adult treatment has its own challenges, but science is evolving similarly. So lingual orthodontics, where braces are put from the back side of the teeth, was a big fashion statement in the 90s and the 2000s, and recently there have been more advancement in the lingual appliances, which have become more CAD/CAM oriented, so more precise and more accurate and quickly working on the treatment outcomes. There are also aligners which have changed the way we do orthodontics. So these aligners are transparent trays which are not visible. This is a very good way of treatment of an adult, because the appliance is not visible and the teeth are getting aligned over a period of time. There are also accelerating methods. You can use low density laser, you can use a micro punch propel or other devices which can increase the rate of tooth movement, low dose radiations of ultrasound. So there are multiple ways, vibration which have been added on. Though there is no concrete evidence to say that you can increase the rate of tooth movement, but there are multiple modalities which scientific literature is working on how to accelerate the rate of tooth movement. And I believe that over a period of time, more and more adults will opt for treatment, because to get an ideal occlusion in a patient who's older, you will need orthodontics to align teeth, so that the restorations as well as the issues like temporomandibular joint disorders and sleep issues can be sorted out using an orthodontist's help, especially in cases which require orthognathic surgery.
So when we talk about adult orthodontic treatments, I think many things come into the picture, right? Another very important thing that has increasingly become an important consideration in all walks of life is mental health, right? My question to you is, how does orthodontic treatment, or maybe dentistry in general, influence the psychological outcome in patients, particularly in terms of self-image or confidence?
I wrote an editorial a few years back on Zoom dysmorphia. Actually, when COVID happened, all of us were locked down and we were working on Zoom meetings. We were not used to it. So we started looking at our faces even more, on a Zoom meeting. So people started looking, and they realized that in the morning they would comb their hair, they would get ready, and they would, walk away. But now they were looking at each other, and they were seeing themselves, and people wanted to think about how they could improve their faces, their images. The issue is that orthodontics and dentistry, what is the first thing which we see is the individual's face and the smile. So the smile, sometimes makes or breaks things. So for the emotional well-being, many people, when you meet people on the road or when you meet at the workplace, the people who have this smile curve, they are the people you usually like to relate to. So smile and dentistry are, go hand in hand, and I believe firmly that for the psychological well-being, it's very essential to have a good smile. It is very essential for the person to be able to communicate to the outside world. So a good speech is very important. Similarly, for healthy life, we need good mastication. We need to be able to bite our food well, and we need also to be able to have a good robust body. So all those are related with dentistry, they are related with orthodontics, they are related with smile. Also, we need to realize that for pediatric health, for children who are growing, not only in terms of psychology, being teased in school because of protruding buck teeth, or them having an having an airway which is deficient and their growth is deficient. Orthodontics not only entails just alignment of teeth, it also entails the opening up of the airway. It also entails prevention of tooth trauma, where these teeth will be lost when the child falls because they are protruding forward. So there are a number of issues, and this teasing in class, or that people in the workplace, the adult patients who cannot openly smile because their aesthetics are not good, are part of this issue. So I'd say psychological health, emotional health, and social interaction. All these three factors relate to an outcome of self-esteem and an outcome of confidence building, and dentistry and orthodontics per se are the game changers in this field.
Definitely. In the social media era, I think we have all become more self-conscious, and aesthetics definitely do matter. So before we wrap up, one last question for you. As a leading figure in the field of dentistry, what future trends do you foresee taking the center stage in the field of orthodontics? And how should professionals prepare for these emerging developments?
I think the first trend which is big is digital orthodontics, and digital orthodontics is here to stay, and digital would also encompass role of newer modalities like aligners. So what is required is the professional to train in these modalities, because the learning curve is long. So I would suggest that with the changing times, the professional has to train in the role of digital technology, learn scannings, learn CAD/CAM planning, and also aligner printing. The next trend is AI and machine learning. Now, AI and machine learning is also something which can help us in our diagnostics. It is something which can help us in planning treatment. So basics knowledge on AI should help a clinician to be able to understand and how to use the algorithms. The third important thing I believe is accelerated orthodontics, because in today's time and era, everybody wants treatment done very fast. So to get a fast outcome, we need to explore the modalities which can make our treatment outcome faster. So learning those modalities and trying to use them in practice is the third thing I think is important. The fourth thing I think important is interdisciplinary care. We need to expand beyond our horizons of just looking at our specialty, work together as a team with all these specialties, including medical professionals, and try to think in the best interest of the patient. So what is required is more interaction among the medical colleagues, dental colleagues with each other, so as to give a suitable outcome to the patient, which is the best for the patient. Now, sustainability. The world is talking about ecologically balanced outcomes. Now, when we talk about the newer modalities, we are talking about plastics, we are talking about aligners. Aligner disposal should not be at the hand of the patient. We have to take the onus of using technology in such a way that we are reducing the use of plastics, or we are trying to look at newer materials which are biodegradable, which can be eco-sensitive. Now, another thing I think is the future is personalized dentistry or personalized medicine, wherein we need to train ourselves into the basics of genomics, try and understand that we need to predict outcomes, we need to select proper cases, and we also need to plan the treatment according to individual patient need. So I think these are the few advancements which we need to prepare for, and they will be changing over a period of time, and to excel and give best outcome to the patient, we also have to evolve with the time.
So in short, dentistry has to be global, sustainable and digital,
Yes.
right? Okay, so this brings us to the end of our today's episode. Dr. Batra, thank you for sharing your incredible expertise with us. And to our listeners, thank you for staying with us till the very end. We hope that this discussion was helpful and we were able to answer all of your questions. But if you have more questions for us related to the field of dentistry or any other topic in general, do drop them in the comments. We'll be more than happy to answer them. So, see you in the next episode of the Manav Rachna podcast. Till then, take good care of your oral health, because healthy is beautiful.